maybe Chinese medicine is removing obstacles to cure.
That's what it's all about. And the obstacles are really the pathogens. And those are the things that the remedies are so effective with. People notice. They take the remedies and they feel better. Particularly Candida. I mean, over 90% of our population has Candida. And they all think it's normal. That gas, bloating, you know, all that stuff that goes on. Everybody just thinks it's normal. And it's not.
You still test them for the different pathogens, or?
Well, we know the pathogen is Candida. Okay. The remedy that I have works like dynamite. It's one of these dropper bottles over here, and gosh, the Candida really dislikes it. And people who start on it notice an improvement in their digestion. I mean, 24 hours, it changes. And then I also make them some little tablets to take after food, which are a combination of some homeopathic remedies that also help get rid of the Candida. It's a huge problem because the Candida, I mean, it destroys your nutrition. It's hanging out right here in your gut, gets first choice on food. You're living on leftovers, no matter how good you're paying attention to your diet. You don't get first choice. So it gets the nutrition, and what does yeast do with water? It just sucks it right up. So even if you drink enough water, you're not getting it. The end result of that Candida is dry cuticles. You see people's feet, the heels are dry and cracked. That's just a raging symptom of Candida. The extremities aren't getting enough water. And if the extremities aren't getting enough water, neither are the organs. So Candida is really a big deal. We continue to feed the Candida with the American diet of white food, dairy, sugar, and yeast. So that really promotes the Candida. So when I talk to somebody about diet, that's a big deal. Dairy, sugar, yeast. In the 20 years I've been practicing, I'll bet I've had somewhere between 5 and 10 people who did not have Candida out of the hundreds who have come. That's a pretty tiny percentage. And what I find in the allopathic community is that it seems to be split 50-50. It's very interesting. About half of the doctors think, oh, well, this is just a female problem. It's not real. Here, have some Valium, dear. Seriously. They do not believe this is a problem. The other half of the community, they know it's a problem. And fortunately, they now say, yes, we know this is a problem, but we don't know what to do about it. What they used to do in the 70s was they would treat Candida with antibiotics. Well, it's a yeast form. Antibiotics have no effect whatsoever. All it does is continue to destroy the bacteria in the colon and make the healing process take even longer. Fortunately, they're at least not doing that anymore. So they have no clue what to do, and most of them don't even recognize it as a problem.